I don't think people understand the importance of lower genital tract infections. Today, we'll be delving into the world of lower genital tract infections, or LGTIs. These infections are common, affecting millions of women worldwide. Understanding LGTIs, their causes, symptoms, and treatment options is crucial for maintaining good sexual and reproductive health. We aim to provide you with clear and concise information to empower you to take control of your health. We'll be discussing 5 common LGTIs: vulvovaginal candidiasis, trichomoniasis, bacterial vaginosis, gonorrhea, and chlamydia. We'll explore each infection's specific characteristics, including its cause, risk factors, typical symptoms, how it's diagnosed, and the available treatment options. Whether you're experiencing symptoms or simply want to learn more, this information will equip you with the knowledge you need to make informed decisions about your health. Remember, seeking medical advice if you suspect you have an LGTI is essential. Early diagnosis and treatment are vital in preventing complications and ensuring a swift recovery. So let's dive in and explore the world of LGTIs together. Vulvovaginal candidiasis, more commonly known as a yeast infection, is one of the most prevalent LGTIs. This infection is caused by an overgrowth of a type of fungus called Candida, which is naturally found in the vagina, but usually in small amounts. When the balance of microorganisms in the vagina is disrupted, Candida can multiply rapidly, leading to an infection. This imbalance can be triggered by various factors, including hormonal changes, certain medications like antibiotics, and underlying health conditions like diabetes. Recognizing the symptoms of a yeast infection is essential for seeking timely treatment. Typical symptoms include itching and irritation in the vaginal area, a thick, white, cottage cheese-like discharge, redness and swelling of the vulva, and pain during urination or intercourse. As mentioned earlier, several factors can contribute to the development of vulvovaginal candidiasis. Hormonal fluctuations, particularly those associated with pregnancy, menstruation, or the use of hormonal contraceptives, can create an environment in the vagina that favors Candida overgrowth. Antibiotics, while effective in treating bacterial infections, can also disrupt the natural balance of bacteria and fungi in the vagina. This disruption can inadvertently lead to an overgrowth of Candida, resulting in a yeast infection. Certain health conditions, such as diabetes, can also increase the risk of developing vulvovaginal candidiasis. Diabetes can affect the body's ability to regulate blood sugar levels, and elevated blood sugar can create an environment conducive to Candida growth. It's important to note that while yeast infections can cause significant discomfort, they are usually not serious and can be effectively treated with antifungal medications. Section 5. Diagnosing and treating vulvovaginal candidiasis. Diagnosing a yeast infection typically involves a pelvic exam and a review of your medical history. Your healthcare provider will ask about your symptoms and may take a sample of vaginal discharge for microscopic examination. This examination helps identify the presence of Candida and rule out other possible infections. Treatment for vulvovaginal candidiasis typically involves antifungal medications available in various forms, including creams, ointments, tablets, and suppositories. These medications work by inhibiting the growth of Candida, effectively clearing the infection. Over-the-counter antifungal medications are often sufficient for treating uncomplicated yeast infections. However, if your symptoms are severe, recurrent, or you have underlying health conditions, your healthcare provider may prescribe a stronger antifungal medication or a longer course of treatment. It's essential to complete the full course of treatment as prescribed, even if your symptoms improve before the medication is finished. This ensures that the infection is fully cleared and reduces the risk of recurrence. Section 6. Trichomoniasis, an often overlooked infection. Trichomoniasis, often referred to as trich, is another common LGTI. Unlike a yeast infection, trichomoniasis is caused by a single-celled parasite called Trichomonas vaginalis. This parasite is primarily spread through sexual contact. Trichomoniasis can affect both men and women, but symptoms are more common in women. Many women with trichomoniasis experience no noticeable symptoms. However, when symptoms do occur, they can be quite uncomfortable and include a frothy yellow-green vaginal discharge with a foul odor, itching and irritation in the vaginal area, pain during urination, and discomfort during intercourse. If left untreated, trichomoniasis can increase the risk of other STIs, including HIV. It's important to note that trichomoniasis can also cause complications during pregnancy, such as premature rupture of membranes and preterm labor. Section 7. Bacterial vaginosis. Disrupting the vaginal balance. Bacterial vaginosis, commonly known as BV, is another prevalent LGTI. Unlike yeast infections and trichomoniasis, BV is not caused by a single organism, but rather by an imbalance in the natural bacterial ecosystem of the vagina. Normally, the vagina is home to a diverse community of bacteria, with lactobacillus being the dominant and beneficial type. Lactobacillus helps maintain a slightly acidic environment in the vagina, which inhibits the growth of harmful bacteria. However, when the balance is disrupted and other bacteria such as Gardnerella vaginalis overgrow, BV can occur. BV often presents with a thin grayish-white or yellowish vaginal discharge with a fishy odor, particularly after intercourse. Other symptoms may include itching and irritation in the vaginal area and burning during urination. However, some women with BV may not experience any symptoms at all. Section 8. Gonorrhea. More than just a passing concern. Gonorrhea is a bacterial infection caused by the bacterium Neisseria gonorrhoeae. It is a sexually transmitted infection, or STI, that can affect both men and women. Gonorrhea is highly contagious and can be spread through vaginal, anal, or oral sex with an infected partner. Gonorrhea often affects the mucous membranes of the reproductive tract, including the cervix, uterus, and fallopian tubes in women. It can also affect the urethra, rectum, throat, and eyes. Many people with gonorrhea, especially women, experience no symptoms. However, when symptoms do occur, they can include painful urination, increased vaginal discharge, abnormal vaginal bleeding, and pelvic pain. If left untreated, gonorrhea can lead to serious complications, including pelvic inflammatory disease or PID, which can cause infertility.